HIV is a dangerous disease that affects millions of individuals across the globe, and today we will examine how the US, Kenya, and France all deal with this disease. When using comparative analysis amongst the countries, similarities and differences were discovered. Each country dealt with HIV through three important factors: healthcare, organization, government, and social. There are some common misconceptions on HIV and AIDS, and that is mainly how this disease is transferred. HIV is actually spread through blood and bodily fluids. Examples of this can be from unprotected sex or unsterilized needles. When looking at the picture and the graph presented right here, it can be seen that Africa makes up a significant portion of people living with HIV, followed by Americas, then Europe. How HIV is treated and affects a population is based on the healthcare system each government implements, and the US, France, and Kenya each have their own unique healthcare system. The US healthcare system is a mixture of factors seen on this picture demonstrated below, and this means that individuals do not receive equal treatment, and this can result in inconsistent treatment for HIV across communities. On the other hand, however, France provides universal coverage, assuring that all residents have access to necessary healthcare services. Although the financial burden is removed, there can be disparities in access to healthcare services across urban and rural areas. When looking at Kenya, they have a mix of public and private healthcare systems in which public healthcare services are provided by the government and even faith-based organizations. However, Kenya has a serious resource constraint, such as funding, and it leads to inadequate health infrastructure and personnel. The level of prevention and treatment is determined by how much the government of the country is willing to spend and overall provide services for communities. In the case of the US, HOPWA is an opportunity for HIV/AIDS support that provides housing for low-income families that live with HIV. When looking at France in turn, through the Sécurité Sociale system, France ensures that all residents have access to necessary healthcare services, including HIV testing, treatment, and even ongoing care. In turn, despite Kenya having restricted government spending in HIV services, Kenya has a strong community health programs that focuses on preventive care and even health education for certain individuals that live in the areas and regions across Kenya. Although the healthcare systems have some differences, there is one big theme that each country provides, and that is the accessibility to the medication and antiretroviral therapy that treats HIV and improves the quality of life for patients. Through the antiretroviral therapy and medication, the numbers reflect a decrease in AIDS-related deaths and steady increase in the amount of people wanting to receive the HIV treatment, seen on this graph in the presentation. Despite the number of individuals receiving treatments and the overall deaths decreasing, there are still negative connotations with individuals that live with HIV and AIDS. This leads to discrimination and is most harmful for gay men in the US, immigrants in France, and women in Kenya. Although different groups of individuals face discrimination, there seems to be a commonality, and that is the negative perception and social problems that arise from HIV and AIDS. There are heavy burdens of shame, discomfort, and even loneliness across individuals. Due to discrimination, some common psychosocial problems that may arise from HIV/AIDS patients can be poor social support, perceived stigma, depression, suicidal ideation, and even attempts. However, there have been positive social movements that are trying to stop the overall HIV stigma, such as the Minnesota AIDS Project working to educate and change public perception of HIV. In addition to this, since France is a universal healthcare system, there are antiretroviral therapy and government-funded services that individuals can seek government treatment and survive the once-seen life-threatening HIV virus. Overall, these countries are creating a positive impact where there are now opportunities for people to go out and seek help. The efforts from both France and the US can be reflected from the graph presented in the presentation. Recent trends indicate throughout the last 25 years, there have been a decrease in the amount of people acquiring HIV and a decrease in the number of HIV-related deaths. Now more than ever, countries have come together to spread education and awareness to HIV and AIDS. The global effort has continued to recognize this public health crisis and will continue for decades to come. Overall, developed countries such as the US and France have more government funding, which leads to more interventions on this epidemic compared to developing countries such as Kenya. Different healthcare systems mean different levels of accessibility and overall care. However, each country has stepped in the right direction, providing antiretroviral therapy and even treatment. Although there will still be HIV discrimination, the US, France, and Kenya have implemented community programs and public awareness campaigns that shed the burden of having HIV and educate individuals on the subject. Thank you for listening.